Today I'm going to show you how to fix your knee pain long term. We're going to show you how it works, why it works, what are the pieces of it, and if you cannot do it, I'm going to wait till the end, and I'm going to show you, you wait till the end, I'll wait till the end. I'm going to show you a supplementary way to do this so that it can help you and assist you to go a little further. But first of all, welcome to the Anatomy of Therapy. I am Dr. John Cybulski. This is Knees Over Toes Guy. This is one of the staples of his movement for a very good reason. It is quality in so many ways. But this is the reverse Nordic. Let's kind of go over it. So we know that a Nordic is focusing on the hamstrings, right? This is a quad focus. And how is it going to help your knee pain? It's very simple. So very quickly. Nordic is where we go forward. Reverse Nordic is where we go backwards. Pretty simple. Most knee pain is when you feel pressure in your knee. So much pressure so that it causes pain. This is all about pressure regulation and dosage. With this exercise, we are training our body to feel pressure through the quad and not the knee. Pressure, movement, force, stress should go through the knee, and the muscle belly is really where we should feel the force, the tension, the strain, not in the joint. So this is going to train us to do that. But what does this look like? That's how it's working. Why is it working that way? So we're in the tall kneeling position to start with. You can be flat on your toes or your toes can be up. Either way, it's fine. I like toes back. It's a good way to do it. You'll see why in a second. And then you're just going to kind of fall back and control back. This is called eccentric extension of the quads. So you're flexing the knee, but you are moving your body into extension, i.e. beyond, backwards, behind your center of mass, right? So we want to feel the quads. That is the goal of this exercise. Load the quads, deload the knees. That's the whole goal. But now, the best part of this, the brilliance behind it, is that it is a self-limiting exercise. It is controlling how far you can go. So how far you can go will determine how good you are at this exercise. Ben is a master at this exercise. When I give this to patients, typically they go back this far, maybe 15 degrees, maybe 20. If you can get back almost like 45 degrees, that's fantastic to start with. How do you know when to stop? When you start to feel it in your low back. If you start to extend in your low back, that is where we stop. These quads are a great muscle to help you maintain a neutral pelvis. If you can maintain a neutral pelvis because you feel these quads, you will not feel your low back. So is this for your knees? Is this for your low back? Yes, but this is a good way to measure. I get this question a lot from patients. How do I know I'm better? Well, if you can go back further and further each week by week, your knees are going to get better. Sometimes you just have to be patient with these results. But the idea is this. So we're loading up the quads. This is going to be a great hip flexor release. And it's going to be able to, you're going to be building some self-awareness in your low back. When you start to extend, the exercise stops. Self-limiting, no extending the back. And I'll show you another way that Ben is doing this really well. So he is neutral through here. But what he is doing is really flexing forward at the sternum. We've talked about the sternum before on a shoulder exercise, pointing the sternum down to keep a neutral spine through here. And that is why you can see his abs and his serratus muscles engaged. That tells me that he's in the right position. Then we know that the lumbar spine, that's the glutes. This is the lumbar spine is being decompressed. You see all the compression here, all the compression here. Decompression there, fantastic, and decompressing in the knees, this is what we want. You're not going to be able to go back this far every time, and that's okay. But if you can't, here's the supplement for it. This is my friend from Belgium over here. So what we do is we get a band, a big rubber band. I know you guys have these. These are very popular these days. Tie this up to a rack. Hold on to it with one or two hands. He's doing one. That's fine. I do it with the arms straight out. It doesn't really matter. But let it give yourself a little bit of an assist to kind of pull yourself back. So it'll take a couple pounds of pressure off, but you still have to keep a neutral low back, a neutral spine, and you should feel a ton of work done here in the anterior chain through the quads, and it will deload your knee and will deload your low back. Sets, reps, dosage. You guys have left some wonderful comments. Please leave more comments below. Tell me what I missed. And in fact, go listen to our podcast on this one. I'll put a little link to it up here. We talk about it for about 30 minutes, all the pros, all the cons, all the wonderful things that you can get done with this exercise. But the big thing is do not extend in your back. Keep a neutral pelvis. Tuck, and my man Joachim over here is doing really great. You can kind of see how this is almost rounded in the back here. So he's really flexing his thoracic spine. Great neutral low back, great neutral pelvis, and he is going to get a ton of burn through these quads. So this will destroy your quads and deload the knees. That is the biggest thing. But the biggest thing is that it's a self-limiting exercise and you can progress this. Dose, load. How much should you do this? How long should you go? If I would first say you need to warm up before you do this. This is kind of the big money, a part of your exercise. So do a general quad stretch, get a good warm up, foam roll, maybe do a wall stretch, hip flexor stretch first, and then bust out a bunch of these reps. As you do this, you are training the position of your body. You are training this neutral spine, you are training neutral hips, you are training your body to load up your quads and to deload the knees. This is a broken record at this point, but you need to go, and as soon as you start to lose form, that's where you stop. And you'll be able to tell, sometimes people like to kind of do a video of themselves and see how far back you go. Look, don't be surprised. If you can go back 30, 45 degrees, that's awesome. It's really, really tough. If you have knee pain with this, give it a little bit of time, because one of the things that this is actually doing as we're flexing the knee, this is actually gapping the knee joint. You're putting and you're opening up the knee joint, which is fantastic. This is an old PT exercise where they would put like a towel between the knee and you would pull the knee backwards. Knee flexion is key. You want to load the knee, you want to flex the knee, but feel the load in the quads. Get in hecka redundant. If you guys have questions, comments, concerns, leave them below. Go listen to our podcast on reverse Nordics. Go follow Kneeovertoesguy. This is just a small part of a bigger part of his program to help fix your knees. Hopefully you learned something here today. Smash the like button, hit subscribe. We're putting out some more videos. What videos do you guys want to see? What exercises do you want to see? What problems do you have to see what exercises you need to see? I would love to help you. You guys have been awesome so far. Check out Knees Over the Toes Guys. Blah, blah, blah. Have a great day. Peace.